The doctor is in. It's our weekly medical segment that we do every Tuesday. And joining us is the doctor, Dr. Ira Zunin. He's the medical director with the Manakai o Malama Integrative Clinic. Good morning, doctor, and thanks so much for joining us.
Good morning, Mahia. Good to see you again.
So this morning we're talking about prostate cancer, and there's a controversy over screening for older men, 75 and older. Why the controversy over prostate screening?
It's an interesting question. What we find is that if there is prostate cancer in men 75 and over, the chances are it's not going to be that aggressive. It may not be their major problem for the rest of their life. So there can be some unnecessary worry and even possibly some unnecessary treatment if we find it so late in life. And
this is a new study that just came out last week, and it might be confusing for some people. So do you get tested for prostate cancer or do you not?
Yes, prostate cancer is one of those things where there is a good screening set of screening tools in place, like mammograms for breast cancer. There's the PSA, which is a blood test, and there's also examination by the doctor to actually feel for any irregularities.
So it's really up to the patient and the doctor, or how do you know when to get screened or not?
Well, generally we start screening in middle age or early middle age, and the big question now is how long we continue to screen. So this is the point of the controversy we have.
And how dangerous is prostate cancer in terms of fatalities?
Well, prostate cancer, it tends not to be as fatal as other cancers like lung cancer and colon cancer, which are also very common. And there are good treatments. Sometimes surgery, sometimes radiation is used. But the key is really to find it early, in men that tend to be a little bit younger rather than the older men.
Now, turning on to another new study out of Stanford that just came out last night, it talks about running and how it helps you live long. What does the study say?
That was a great study. It just hit the wires. And the Stanford researchers looked at people over a 19-year period, started looking at their health in the 50s, and found that runners actually live quite a bit longer and have disabilities much later and much less often. It's even more good for our health than we previously thought.
And what about all of the injuries? I mean, some people, they get a sore knee or a sore foot. It doesn't take those injuries into account?
Well, it does take those injuries into account, and it says that even with those injuries, it is good for our health. But you're right. Running is considered a high-impact exercise, and it's not without cost to the system. It does wear down those joints.
All right. Well, Dr. Ira Zunin, thank you so much for joining us. We appreciate your advice. And if you have a question for the doctor, you can write to us at morningmail@kitv.com, or you can log on to our website, kitv.com/thismorning. And stick around. We'll be right back after the break. You're watching KITV4, your island television news this morning. And here is a live picture toward Cocoa Head. It is 5:50.